One. Testing. 1.
We're ready.
2.
It's
3.
live.
Is everybody ready? Hey, what's happening, Fulton?
Hey, Dr. Scott, how you doing?
I'm doing great. It's good to see you, my man.
You know what? I feel like I cross paths with you all the time, and everything is work. It's just minutes or seconds of interaction and back to the next thing. You and Advanced Medical Solutions, you're one busy man. That's one busy place. There's a lot of people feeling better, getting out of pain today, and it's all because of what you at Advanced Medical are doing. Congratulations, Dr. Scott.
Thank you. Well, it's my mission and purpose to help alleviate the pain and suffering of people, help people avoid the dangers of modern medicine. The same thing that was gifted to me when I was young, a teenager, 12 years old to 16 years old, suffering with migraine headaches, on medication, 275 pounds, recommended for surgery. Someone taught me how to take control of my own health and get healthy without drugs and surgery, and that's what I'm committed to. Not only am I committed to it, it's also my responsibility. And even better than that. It's better than that, but that's the primary purpose, okay? It's my responsibility, okay?
Yes,
it's my divine responsibility. But even better than that, this is why you love me. Because it's fun.
Oh, it's so exciting.
I mean, it's busy, and we work our asses off, but it's fun.
Man, it's amazing.
It's fun. The work we do is fun. It's scientific. It's changing people's lives. So I'm an addict for science and spirituality. So when we use science to help people feel better, we've talked about it over and over.
Amen.
They feel better. It clears up their mind. When you can clear up the mind, it makes room for other things and other people. And it has this spiritual component of you're not being so selfish because you have to be in the pain.
Correct.
You're considerate of other people.
Yes.
You're considerate of other people, and that's really where what starts tapping into this humanity or spiritual aspect of taking other people's thoughts and feelings and considerations. So what we do is busy, it's hard work.
Yes.
It's fun.
It's a lot of fun. You say that, I think of myself and what I do with you and the team at Advanced Medical Solution, and it's like riding a roller coaster, okay, because you can feel that climb, and you know your heart's about to drop, your ears are going to pop, and everybody on that roller coaster is about to scream, okay? It's exciting. Every patient we experience is that excitement over and over again. And that's why you and I get so upset when people aren't willing to take such an effortless step to call the office to get out of pain and suffer and suffer and suffer.
It's very frustrating. Now, here's the thing. It's not just so exciting. Like you said, it's a roller coaster. Because I sit in these rooms and I go to dinner with these patients and we're talking about, it's not exciting. We're talking about the pain that they're having. They've been suffering with pain for 2 years, 10 years, 40 years. And we'll be talking about the pain that they're suffering with. And people suffer with pain for years. Even decades.
Lifetimes.
They change. They just get adapt to it. And then once we start talking about it and we start finding out the real deal of what's going on and why they want to get fixed, it's not because they're in pain. It's because they can't live the life they want to live. They can't even use the bathroom and clean themselves like they're supposed to. They can't play with their grandkids. They can't spend time with their kids, their grandkids. They can't work. They're losing money. So it's very sad. I mean, we're in tears sometimes with the way people are suffering. And they weren't in tears before. They weren't in tears a year ago. They weren't in tears 10 years ago, because that slow pain that continues to build and build, they live with it and it just becomes natural life. And then when we really start talking about why are you really here, why you really want to get this fixed. Okay, I know you're in pain. I know you're tired of hurting, but what's really going on?
What else?
What do you really want to do? I can't play with my grandkids. I can't even pick. I had a 30-some-year-old father today say, as soon as I pick up my child, I am in severe pain for at least 30 minutes to an hour.
Wow.
And that's my child. That's my 2-year-old child that I can't even take care of. And so there are these heartfelt, emotional things, recreational things, golf, pickleball, tennis, these things that people want to be able to do, work out, get healthy, lose weight. These are the things they really want. They don't really want the treatments that we have. The treatments are just a tool that's so effective and so fast it gives them their life back. That's the roller coaster. It's misery. It's sad. It's humbling. But when they take that effort, it's effortless, but when they take that move to the next step of doing these most advanced, the cutting edge, most innovative medicine that we offer, along with the other things that we do, okay? When they take that step, it is a radical shift, and I'm talking within days. The stories I hear, I just heard it the other day. Somebody said so-and-so came in. It's only been a couple of days after her treatment with that gold standard treatment.
Yes.
And she came in, and she was smiling so big. I mean, I just can't. It's just over and over and over. It's amazing.
You know what? Yes, it is amazing. I will add that. I think about the couple we had in here a couple of weeks ago, and when we brought the lady in and she started explaining her condition, and you and I see these people, I mean, not every week, but we have so many testimonials come in here, and we hear these stories over and over and over. But when she was explaining her personal story, her situation, you could see the anguish in her face. You could see the pain that she had been through for so many years. Yes. She had become somebody she was not. That's not who who she wanted to be, who she chose to be. It was who she was forced to be, and it was all because of pain.
That's right.
It was all because of pain.
That's right. And she didn't have an answer.
No, she had nowhere to turn. But then she found you, Dr. Scott, and she came to Advanced Medical Solution. And as soon as we asked her about the change, there was a smile on her face, and her face, it was lit up the entire rest of the show we did with her.
Yes.
Okay?
Yes.
And when we finished that show, what did she do? She stood up, she thanked you, she hugged your neck, okay? And she said she's your number one cheerleader.
Yes.
Now, I'll be honest. She's got a long line to stand in to be number one for Dr. Scott at Advanced Medical Solutions, because there are so many patients out there, Dr. Scott, who say the exact same thing she does. And that's the wow me effect for me. That's what I enjoy seeing. That's what I get up, just like you in the morning, thinking, who gets help today? Who gets out of pain today? Whose life's going to be different because of the studying you've done, because of the hard work you've put into it, and because of the application of everyday life that you give these patients to come see you at Advanced Medical Solutions?
I love our patients. And I love seeing them get better. I don't like the attention, and I really don't like people acting like I'm the person that helped them, and they say, Dr. Scott saved my life. I'm really just doing my job, okay? It's just my responsibility. When you have a certain amount of knowledge and experience, you have a responsibility to do that. I don't really like the attention in that manner. I'm just doing my job. I don't need praise for doing my job, okay? What I do love is the fact that it's not really me, it's really them. It's them,
Yes.
It's them. They made the decision, I read the Bible. It says faith without action is dead. And so what's happening is these people are taking a certain amount of faith and trust in me and in the science that I share with them and the results that we've seen, and they're taking that little bit of an action step that creates a miracle in their life.
You bring something up there that you and I were talking about on the way here. Why don't you go ahead and mention what is taking place right now? And we've got some news out there that's just been released.
It was in the Wall Street Journal.
Yes.
Wall Street Journal. Here's the thing. We've been doing this. We've been at this almost 5 years, okay?
Yes.
The Wall Street Journal just now posted, a week ago, September 9th, an article that talks about exactly what we have been doing for the past 4 years. It says a knee or hip replacement without surgery is on the horizon. It reads, with better stem cell therapies, researchers hope to repair cartilage or prevent damage before arthritis and pain sets in or an operation is even needed. This is what's going on. It talks about an injury or trauma to the cartilage around knees, hips, shoulder joints leads to arthritis. Any kind of trauma is eventually going to lead to arthritis and pain and even degeneration, and the need for a new joint. The surgeons, they're doing cortisone injections until they have to do surgery. That wear and tear happens over age, time, and then one day, which is now, stem cell therapies can stop the degeneration even before it starts. Now, we've stopped it and reversed it when it's even there, but they're actually talking about now some preventative measures using stem cell therapies to do to avoid degeneration and arthritis before it even starts. This is phenomenal. We know it's been there. It's been in the research for decades. We've been doing it for a half a decade, and now they're putting it out there. And I love that it's in the mainstream media.
Yes.
I love that it's in the mainstream media. As far as Wall Street Journal goes, I'm not a big fan of the mainstream media. However, for this to be out there, it means we are headed in the right direction on a cultural level. You know,
I do.
On a cultural level.
And you sent this to me before we came. Here's my notes. Here's what we're looking at. Be prepared. Okay. I get all excited. I open this article. I read through it, and I'm like, well, wait a minute. Somebody at the Wall Street Journal's been listening to Dr. Scott and I on the radio because we've been talking about this for years.
They tapped in.
They did.
Yeah.
They're listening, Dr. Scott.
Thank God.
They're listening. Yeah. People are hearing what you and I are saying right now. And the Wall Street Journal is now printing what you and I have been saying on this show for a couple of years now.
That's right. That's right.
And this is amazing. So people can start to see the gateway opening up for exactly what you're
That's
saying.
Exactly right. They're not only hearing us, Fulton, but what's happening is there's so many people right now suffering in pain. They are miserable. They're in pain. Their whole life is revolved around that pain. Their family, their spouse, their life is affected and revolved around that pain. They're getting addicted to pain medications, the opioids. I mean, it's worse than it's ever been before, and it's better than it's ever been before.
That's crazy.
And that's from what we're doing. And so what happens is we've taken care of thousands of people over the past 4 years, almost 5 years now.
Yes.
Thousands. And when those thousands of people, see, they're not just listening to us, they're listening to those thousands of people. They're listening to them. These are people that were suffering and miserable in pain for years and decades, gone through surgeries unsuccessfully or on the brink of having a surgery, and they're trying to avoid it, and they get one treatment with the most innovative medicine that they're talking about in the Wall Street Journal. Mm-hmm. These patients are getting one treatment, and it's changing their life. It can't be ignored.
It can't be ignored. And now you mentioned something just a moment ago that picked the scab raw for me, brother. I'm going to be honest with you. When you said opioid addiction, where are we against? We're against big pharma. Here comes the battle, okay? And this upsets you and I the most. We are more upset about people not getting what they need because of big pharma and insurance. It's unacceptable. It should not be taking place, and we need these patients to step up and support what you and I are doing and let this industry grow.
Yeah, because there's no way... there's no way anything's going to stop the negative aspects of big pharma, the government medical media complex. We can't stop it. It's too big. And also it's too confusing. Let's just, as far as big pharma, I don't hate big pharma. I don't hate the medical establishment. Hell, we have a medical office.
Yes.
But it's confusing because some of those drugs work really good and they're very effective and they don't have dangerous, deadly side effects. However, the other half does. And not only are they dangerous, but they're addictive, and the damage that it has spreads all the way across this person's life.
Yes.
Just like what we do affects every person's life in this person's family, those opioids and these other dangerous medications that people get addicted to, it destroys lives. And nobody knows when it's going to happen until it happens and it's too late.
And it's over.
Yes. The number one reason for people in America going to a hospital other than being born, okay, everybody's born in the hospital almost, is for pain in the back. And
I did not know that.
Yeah, it's for back pain. It's for back pain. So they're going for back pain, and you know what they're prescribed.
Oh,
okay,
of course.
And then that prescription leads to an addiction to these medications, and when they can't get the medications, you know what happens next. It's even worse.
Yes.
They're going to the streets.
Exactly.
And it's just what happens. I mean, look at it. There's so many people in pain. They have no other answer, and that's when they'll go in for surgery, cortisone injections in surgery, to try to avoid these pain pills. And I understand that. The problem is there's confusion, and there's limited knowledge, okay? And information is limited on getting out. It's held back. And that's why I love seeing this in the Wall Street Journal, that it's there. I mean, it even states right here that 32.5 million people in America have arthritis. Over 32 million people. That's almost everybody. Okay? We all have it. And look, they're doing 750, almost 800,000 knee replacements a year.
Exactly.
500,000 hip replacements in a year. Okay? Okay, some of this is necessary, and some people want that, and it helps them out. But it's not always effective. Sometimes it destroys people's lives. And there's another option now. There is another option that within 1 hour, in our office, like Advanced Medical Solutions, within 1 hour, with a 10-minute injection process, someone can avoid the dangers and destruction of a knee replacement, hip replacement, any surgery. Within just being in our office, within 1 hour. 1 hour will save months and years of frustration and pain.
It's so simple for you and I to see that. It's so simple for the patients who have been to Advanced Medical Solutions to see that. But for the people out there listening, it's happening every day. Okay? We are doing it. We're seeing it take place, and it's a beautiful thing. But I'm going to go back to what you were talking about, because I'm not, the scab is still, it's still oozing. I'm still leaking about this big pharma. I'm upset about what big pharma has done. These patients are suffering. Their families are suffering, and it's all about greed. It's all about the money. If you could close your eyes and smell the money, you could follow where the corruption is coming from, because that's what's happening to these patients is people are getting greedy, and for their advancement, they're letting these patients suffer, Dr. Scott.
And the problem with that is you can't really see the greed. It's too high up.
Yeah, you can't see
it. It's too
it.
high up and too far back, decades, if not almost a century old. That's how deep it is. So it's so beyond what's actually happening on a day-to-day basis. And when you're in pain, you don't ask questions.
No.
You're trying to get out of pain. That's all you can think about. You don't ask questions. The only question that's asked, okay? The only question that's asked is, does my insurance cover it?
Yep.
And we've been trained to ask that question. Does my insurance cover it?
We have been trained to ask that question.
That's right. Does my insurance cover it? Okay. Yes. Okay. I'm not even going to ask what it is. I don't even know what to decide. Just do it to me. Yet when insurance doesn't cover something, especially that's so effective and been proven to be so effective for decades, now there's an issue. Now there's a problem. Now I need to ask all the questions because I have to pay for it. Well, you know what? I would much rather, Fulton, if you and I went to lunch, if we went to dinner, and you say, hey, Dr. Scott, I'm paying for dinner. Thank you, Fulton. That's so kind of you. That really doesn't happen to me often. But thank you. But you say, now, it could make you sick tonight or tomorrow. You could get a little sick from it. But I'm still paying for it. You're probably going to get sick, though. No, thank you. No, thank you. That's what's happening. Insurance is paying for it. Nobody's really asking any questions. It causes problems later on down the road. We know cortisone advances the degeneration. It causes blood sugar problems. It causes blood pressure problems. But people do it with no questions whatsoever. Why? Because they're hoping to get out of pain. Please. I understand that.
And you know what?
And their insurance covers it. That's why they're doing it. There are no questions asked.
And you have people who will go to the doctor to get a cortisone injection just hoping for 3 to 4 weeks worth of relief.
That's right.
I'm going on vacation. I'm going to see my family.
That's right.
I'm going to see the grandkids graduate. I'm going to, and they'll do that just as a Band-Aid, and they could eliminate it completely by coming to see us at Advanced Medical Solutions.
Let me share with you what's in the Wall Street Journal. They call it the Holy Grail for pain.
The Holy Grail.
The Holy Grail for pain. Let me tell you what this doctor says. This is Mark Hochberg, a professor at the University of Maryland School for Medicine, head of the division for rheumatology and clinical immunology. Okay, the Holy Grail. They call it the Holy Grail for pain. It reads, he says, if we can find some compound and treatment that we can inject into the knee or hip joint or any joints to reduce cartilage degeneration and restore normal cartilage, or both, while at the same time reducing pain, that's the Holy Grail.
That's what we're after.
Well, that's what we're doing.
Empirical therapy.
This
is it.
What we're doing. The treatments that we do, that gold standard human cellular tissue product that we do, that most people recognize it from the research of stem cell regenerative medicine, is what it calls it. It decreases inflammation. It decreases inflammation right away. The next thing it
Yes.
does, it cleans up and tears up scar tissue, allowing somebody to function and move better. And lastly, it regenerates that tissue into newer tissue. The research shows that mesenchymal stem cells actually increases the cartilage quality in these joints. And this is the Holy Grail. I didn't say it. He said it.
He said it. And for him to say it, and the Wall Street Journal publish it, you know, they're just like, as I said, somebody out there has been listening to this radio show and they've heard what's been being said over the past several years. These patients are getting out of pain. These patients are happy. These patients are living their life. Dr. Scott, they are doing what they came to Myrtle Beach and Paradise on Earth to do. They're living their life.
That's right.
They're playing pickleball. They're going to the beach. They're dancing. They're doing it all.
Well, they've worked their ass
Entire
off all
life.
these years.
Yes.
10, 20, 40 years. They've worked hard. They decided to go to a place where they can enjoy life and sit back and relax. And they end up sitting back in pain and suffering. But the good part is now there's an answer. And they're able to come in here, like I said, less than an hour appointment, less than a 10-minute treatment, and they're able to get their life back. I'm talking fast. It's incredible. I can't wait. You know, before as a chiropractor and being a high-level chiropractor and helping a lot of people with things that, you know, I've been able to help people that couldn't get help anywhere else, okay? Just like we're doing now medically with the regenerative medicine, HTCP. It's been almost 5 years, okay? It took a little while in chiropractic, but I helped so many people with so many different things. I kind of became numb to the results.
I know.
I did
too.
It's just too old. I mean, it just happened too much, so I just wasn't too excited. I can't wait. Maybe it'll never happen, okay? Especially with the advancements that we're actually incorporating in with all of our treatments. But I can't wait till it happens that I just really start getting numb, and it doesn't affect me to see people get so much better so fast. Because I like getting excited, don't get me wrong.
Of course.
But I hear all these stories of
Yes.
these patients, and I see them, and it still stimulates this excitement in me. And I know one day it's going to go away because I've had it happen before. I'm just wondering when it'll happen. It's almost so normal that it's just going to happen. But I still get excited about it. Because it's crazy. We're taking care of the worst of the worst.
I know.
Things that I couldn't help people with before.
I know.
Now we're helping them.
I see it every day.
It is.
And I've been
it's
there.
phenomenal.
I know.
And it's fast.
It's quick, and it's the wow me effect once over. You know, I've taken this roller coaster ride with you. I got into this. I'm like everybody listening out there who hasn't done this or knows somebody who has. You know, I want to do my research. I want to be an educated consumer. I want to know what decision I'm making. Okay, so everybody's a little skeptical. You know, prove me
course.
wrong.
Of
Okay,
course.
so once you are proven that it is as effective as you and I see it, there's that excitement you're talking about, okay?
Yes.
And then you see everybody else have that excitement, and it's like you're a member of a club,
Yes,
you know,
yes.
that nobody else gets,
Yes.
but y'all do.
And that's really what it is. It's a member of the
is.
new medicine. There's nothing we can do to stop the big role of big pharma and what's going on. And that's okay because there's a need for that sometimes. It's a new way.
It is.
It's a new lifestyle. It's a new option that you can mix it with what you're doing medically. But it minimizes the need for modern medicine, and you're taking advantage of advanced medical solutions. That's
Absolutely.
why our office is AMS, Advanced
That's where the
Medical
name
Solutions.
comes from.
That's what it's all about. It's a new way of treating your body, honoring your body, and understanding what you really want in life
Yes.
and going to get it. And taking that action step that's where it's at.
That's
where it's at.
The action step is it.
That's where it's at.
And when, you know, you and I see this, all these people, we see so much of it that we almost expect everybody to have these phenomenal outcomes.
Mm-hmm.
And when somebody isn't peaking excellence, we're like, whoa, what's up?
Something's wrong.
Whoa.
Something's wrong. Get in there.
Get that
an
patient
X-ray.
back in
Get
here.
him here right now. Let's see what's going on.
Let's take a look.
Yeah. Very
Absolutely.
rare does it happen, but when it happens, we're all on top of it.
We're on it.
Yeah.
We own it. We don't let them slip through the cracks.
Right.
We don't, you know, because this medicine is growing. It's so super exciting, as you and I have discussed, and we've got so much more that we get to learn, and that's what keeps us coming back every day.
We're in this industry very early. We did it because there's a responsibility to do it, and there's a need for it with people hurting. So I just want to thank the Wall Street Journal for putting the good news out there. Go out, look on the Wall Street Journal, September 9th, 2021. It's talking about this new medicine, this new model, these new options that avoid pain medications and surgeries. I want to thank all the great patients that support us and that trust in us and believe in us. I want to thank you. I want to thank you, Fulton, for going on this journey with me.
Thank you.
It's hard work, but it's fun. So I'm just putting out there a big thanks to everybody.
You know what, Dr. Scott, let me say thank you for the seat on the bus. I'm glad to be a passenger. I look forward to helping everybody that comes in our path.
All right. It's been great talking to everybody today. Be great. Feel great. We'll talk to you next week. Bye, everybody. Cool. That time went by real quick.
Yeah, because we were all into it.
And moving.
Charged.
Yeah, you
Throw it in.